All right, well, good morning and good afternoon, everyone. I would like to welcome you to the Canada Fetal Alcohol Spectrum Disorder Research Network's webinar, Cross-Sectoral Alcohol Policy and Healthy Beginnings, Examples from Two Provinces. Thank you all for joining us today. So my name is Lindsay Wolfson. I'll be your moderator today. For those who don't know me, I am the manager at the Center of Excellence for Women's Health and a frequent collaborator with the Canada FASD Research Network, the hosts of today's event. In my role, I am responsible for research and collaboration on projects relating to FASD and healthy beginnings and the integration of gender, trauma, culture, and equity-informed approaches in policy, research, and practice. I will introduce our three amazing guest speakers momentarily, but before I do, I just want to acknowledge the First Nations, Inuit and Métis as the first inhabitants and traditional custodians of the lands in which we live, learn, work, and play. Today, I am joining from the traditional territory of the Haudenosaunee, Anishinaabewake, Mississaugas of the Credit, Mississauga, and Wendakinia and Wensentio peoples, but I recognize that we're all joining from diverse territories across Turtle Island. An important step in reconciliation is the acknowledgement of traditional treaty lands and recognition for the people of the territory. The Canada FASD Research Network recognizes the historical significance and contributions of Indigenous peoples and their cultures, and understands the important role that Indigenous community plays today and in the future. We acknowledge that we live, work, and meet on the traditional territories across Canada of many First Nations, Inuit, and Métis whose footsteps have marked these lands for centuries. So for some housekeeping items, today is our final webinar in our three-part alcohol policy series. If you missed the first one on alcohol policy in Canada or the second one on Canada's guidance on alcohol and health, they are now available on the CanFASD YouTube channel. In today's webinar, we're going to focus more on how two provinces, Manitoba and Newfoundland, have harnessed policy collaboration to increase governmental and community supports for people with FASD and those who may be at risk of alcohol use during pregnancy. Without further ado, here are three amazing speakers today. Our first presenter is Melanie Muehling. Melanie is the manager of FASD programs and policy at the Department of Families with the Government of Manitoba. She oversees the work of Manitoba's renewed FASD strategy, which ensures that community partners and all areas of government are working together to improve outcomes for people impacted by FASD and alcohol use in pregnancy. Melanie promotes collaborative policy development as the chair of the Manitoba FASD Interdepartmental Committee, member of Canada's Northwest FASD Partnership Steering Committee, and a member of the CanFASD Prevention Network Action Team, or the PNAT. Melanie is joined by our second presenter, Maya Graham-Derman, who is a social responsibility consultant with Manitoba Liquor and Lotteries. Maya oversees MBLL's social responsibility funding, which works to address harms in Manitoba from alcohol, gambling, and/or cannabis. Since joining the team in 2021, she has worked to expand and reach the depth of community funding with a special focus on FASD and TRC Call to Action 33, which is all about community-based FASD prevention. Our final speaker is Suzanne Hawkins. Suzanne is a policy analyst, researcher, and community engagement strategist with experience working for provincial governments, nonprofits, and research institutions across Canada. For the past decade, she's collaborated with diverse cross-sectoral teams on policies and programs to advance the social determinants of health and justice for rural and Indigenous communities. She's currently the Program and Policy Development Specialist with the Government of Newfoundland Labrador's Division of Health and Community Services, Mental Health and Addictions Division. Prior to joining the Newfoundland government, Suzanne was a senior policy analyst with the Government of BC's Ministry of Mental Health and Addictions, Indigenous Partnerships and Wellness team. So thank you for our amazing speakers. We're so excited to have you join us today, and I'm going to pass it over to Melanie and Maya to start us off.
Thanks so much, Lindsay. Good morning, everyone. Yeah, as Lindsay said, my name is Melanie Muehling. Maya and I are very excited to present about what we're doing in terms of cross-sectoral alcohol policy in Manitoba. I'd like to begin by acknowledging with gratitude that we are joining today from Winnipeg, Manitoba, which we acknowledge is on Treaty 1 territory, the ancestral lands of the Anishinaabe, Anishinaabe, Dakota Oyate, Denisoulene, and Nehedawak, and the homeland of the Red River Métis. I'd like to begin by just outlining the provincial FAC strategies. That really is the backbone or the skeleton of what we do in terms of FAC work in the province. The strategy was first launched in 2007. It was recognized that we needed a collaborative cross-departmental approach to FASD awareness, prevention, intervention, support, research, evidence, and service quality in Manitoba. So this strategy ensures that everyone's working together effectively, that we're working across government and with community partners. All programs and initiatives are working together, moving the needle in the same direction to invest in and develop initiatives that support people impacted by FASD and alcohol use in pregnancy. So that's what gives us our mandate to move forward. I work for the Department of Families in the province on advancing the strategy, and I'll talk more about the other players involved in the strategy in a minute. I want to also highlight that the strategy was recently renewed in September 2024. And just to highlight the guiding principles of the renewed strategy, because I think they really do set the tone for the work that we're doing here in Manitoba. Those principles are to center the voices of people with lived and living experience, advance reconciliation and increase Indigenous-led service provision, which includes advancement of TRC calls to action 33 and 34, ensuring service quality and reducing stigma and promoting dignity. The renewed strategy invests in community awareness, wraparound support for pregnant people and families, and increased specialized support for people with FASD across the lifespan so that outcomes improve for people impacted by FASD, including families and caregivers and people and families impacted by substance use in pregnancy. And we'll have the link shared in the chat for some more information if you want to learn more about Manitoba's FASD strategy. So, how do we ensure that the work of the strategy is grounded in cross-sectoral collaborative policy? Well, the simple answer is we fold it in. I hope there's a lot of Schitt's Creek fans on the call today, but if not, a quick word of explanation for this reference. In the show, two characters struggle to understand a recipe's direction to fold in the cheese. But fear not, unlike the mystery that is folding in the cheese, I'm going to explain today exactly what policy collaboration looks like in real life here in Manitoba, or at least a few examples. So first of all, structurally, the Interdepartmental Committee, or the FASD-IC, is the group that guides the FASD strategy. So although the Department of Families is identified as the lead department of the strategy, there are several that are involved in its leadership and guidance. And you see those on the screen. Excuse me. So the Interdepartmental Committee ensures that the work taking place in all sectors of government in Manitoba, sectors like health, justice, education, housing, social services, and more, is all connecting FASD awareness, prevention, and support back to those departmental mandates and priorities. So making sure that, when there's something happening, developing in justice, that we're talking about folks involved in the justice system that have FASD. When there's something talked about in health, we're talking about people who use substance use in pregnancy, and so on, making sure that these conversations come to the table. The biggest thing that I've learned when it comes to FASD policy, and particular FASD prevention and awareness policy, sorry, I'm in here. Someone entering my room here, sorry. It's a topic that belongs at many tables, maybe even all tables. So therefore, I try to be at as many tables, policy speaking, as I can to ensure that FASD prevention is being discussed and addressed from all angles. And when I fail to be in more than one place at a time, I do what I can to make sure that my colleagues have what they need to be the person speaking up about FASD prevention at their tables. So just a few examples of what this looks like that I wanted to highlight. So in Manitoba, we have a 2-day FASD training curriculum that was developed by the Interdepartmental Committee and community partners. It's free for anyone, service providers, caregivers, anyone who wants to take the training to do so. And we spend a great amount of time talking about how normalization of alcohol use in North American culture, along with social determinants of health factors, of course, have a huge impact on the prevalence of alcohol use. When we talk about how trainees can incorporate FASD prevention into their work, we also talk about how they can share information such as Canada's guidance on alcohol and health with people they support to promote safer substance use, both in general and during pregnancies. Canada's guidance on alcohol and health is also a core element of the counseling sessions within Manitoba's Project Choices program, which provides education to youth and adults on FASD, alcohol use in general, safe sex, birth control, and alcohol use in pregnancy in order to reduce the risk of future alcohol-exposed pregnancies. As many of you know, it's an ongoing endeavor to build capacity amongst medical professionals to effectively support pregnant people who use substances. And some of the ways that we've been trying to address that and tackle that is through connections with that sector. So I've been able to be involved in a community of practice of medical professionals called Manitoba iMaples for a few years now, and have been able to be a part of establishing an accredited public education event called Baby Steps, which took place in 2023 and 24, to provide medical professionals with learning about best practices to support people who use substances in pregnancy. The IC has also been able to connect with the Women's Health Provincial Clinical Team in Manitoba, which has allowed us an opportunity to connect with a network of healthcare professionals to share FASD prevention resources and information on an ongoing basis. In education, we've been able to identify that many curriculum outcomes in Manitoba schools relate to FASD prevention. So things like learning about healthy pregnancy, healthy bodily growth, healthy relationships, critical thinking around alcohol use, peer pressure, all of these things relate to that level 2 FASD prevention, that preconception education. And so we offer support to educators to build their capacity as they teach these topics to make sure that they are also part of the solution. Finally, as a course, we're here to talk about alcohol policy. The FASD strategy's goal of increasing awareness about the risks of alcohol in pregnancy would not be possible without partnerships with the liquor folks, the people who are doing this work. So we have a strong connection with the Liquor, Gaming and Cannabis Authority of Manitoba, LGCA, and of course, Manitoba Liquor and Lotteries, which Maya is going to talk about. So just to say about the LGCA, recently we've been able to connect with them as they are developing a public education campaign around the risks of alcohol and cannabis use in pregnancy to point them in the direction of best practices, get them talking to folks in research, in service provision, people with lived and living experience, to learn about what are the effective ways to do FASD awareness. And the LGCA even recently were able to have a conversation with, we have an FASD strategy Indigenous Elders Advisory Circle that meets twice a year. And so the LGCA folks were able to meet with them to have a conversation, a really wonderful conversation about awareness building in First Nations communities and contexts. And so finally, today, we're going to also hear from Manitoba Liquor and Lotteries. Maya was gracious enough to agree to present with me. So, so Maya's going to talk about, just some of the things that we're doing collaboratively to do more together than we could do separately. So Maya, I'll have you take it away from here. Thanks.
Hi, folks. Thanks for the introduction. When Melanie asks you to join a presentation with her, you say yes. So super grateful to be here. As Melanie said, I work at the Crown Corporation in Manitoba that is responsible for alcohol sales, retail, and wholesaling. When I started here, I really identified with David Rose here, being exactly what do you mean we need to fold in the cheese? Learning about FASD and how our role as a wholesaler, retailer, and distributor, how does that play into living out alcohol policy seemed really confusing. But what you see here on the screen, as a Crown Corporation, the benefit is that we have the same stakeholders and serve the same constituents as Melanie and other civil servants. We serve all Manitobans. Though there are several provincially run liquor operations across the country, several provincial Crown corporations, I believe that MBLL is a bit unique. And that's not because of technically an internal policy, it is because of legislation. The text on your screen outlines the section of the Manitoba Liquor and Lotteries Act that is titled Social Responsibility. Section 48.1 gives us a mandate to conduct or fund initiatives related to responsible consumption, which is fairly standard in many publicly owned corporations or organizations in our field. What is unique is Section 48.2 that attributes a fiscal requirement that is tied to the profitability of the business unit. In ever-growing times of austerity where businesses are seeking to optimize efficiencies while provincial governments are struggling to balance budgets and fund social services, having a piece of legislation that requires dollars be set aside to exclusively address harms from the products that we are responsible for is incredibly unique. This legislated requirement means that the corporation has a duty to Manitobans to invest millions of dollars each year into services and programs, and it allows us to dovetail really closely with a lot of the services or strategy that you see outlined in the FASD provincial strategy. So when you have a dedicated budget, that can't be reallocated, it provides us the opportunity to think critically about how we as a corporation can become bold and an influential partner in advancing social good and responsible use in the province, which inevitably means engaging with the experts like Melanie and her team, as well as others. So when I joined in 2021, I was immediately directed to connect with FASD policy team and learn best practices. Over to you, Mel.
All right. So as Maya has said, there is definite overlap and alignment between Manitoba Liquor and Lotteries policy, social responsibility, and the mandate of the FASD strategy. But I think what has really galvanized the collaboration that we've been able to do over the last number of years has been a shared commitment to dignity promoting messages, especially when it comes to how we talk about and raise awareness about alcohol use and policy. We've bought into that wholeheartedly, lock, stock, and barrel. So has Manitoba Liquor and Lotteries. The dignity promotion movement, of course, has always been around, but it really bubbled to the surface for us in Manitoba in 2014, as many things related to the FASD strategy stemmed from community. Regional FASD coalitions were identifying stigma as their largest barrier to FASD awareness, prevention, and support. And so a community-led project called Looking After Each Other was born to promote dignity for people impacted by FASD and alcohol use and pregnancy in Manitoba. And the idea soon arose to have the Frameworks Institute work with Manitoba to provide research recommendations on how to communicate in more effective and dignity-promoting ways about FASD and alcohol use in pregnancy. But how in the world would we pull off such a massive project? Enter Manitoba Liquor and Lotteries. They were approached by my predecessors on the FASD team, and they said, yeah, we see the value in a report like this. We see that it's going to shape future FASD awareness campaigns. We see that it's going to shape FASD discourse as a whole in Manitoba, and we want in on it. So the report was commissioned, and it's called the Seeing the Spectrum Report. It was released in 2017, and if you have not yet had a chance to read it, I would highly encourage you to do so. It's just phenomenal. It's available on the Manitoba FASD Coalition website. We learned so much about communicating about FASD from this report, but for today, I'm just going to stick to highlighting one takeaway, which was to shift the narrative around alcohol and pregnancy from an individual issue, where individuals who drink during pregnancy are seen as morally blameworthy, to an emphasis on alcohol and pregnancy as a contextual issue involving the social determinants of health, requiring collective solutions and support from all of us. Recognizing the importance of disseminating this information, Manitoba Liquor and Lotteries was also a partner with the Canada Northwest FASD Partnership in hosting a national symposium in 2019. And of course, other partnerships for that conference or that symposium included CanFASD, Public Health Agency of Canada, Addictions Foundation of Manitoba. And we were able to have the CEO of Frameworks actually come in and provide the keynote speech of the event. This is also available to view online on the Coalition website, so the link will be up in the chat. The symposium then engaged people from across Canada for 2 days on solutions to change the conversation about FASD and dignity. And the work continues to this day. Back to you, Maya.
So I don't think the importance of the Frameworks Institute report and the research that they did and the report can be underplayed. We want to move to the next slide. The focus on dignity promotion can't be understated. The recommendations from the report made us internally examine how, as a corporation, we contributed to harm across the province in building that stigma. For a long time, Liquor and Lotteries has had the responsibility of communicating harm reduction strategies to the public, not just to consumers. And so for many years, we've had the With Child, Without Alcohol resource guides and public branding campaigns. And traditionally, those included images of the pregnant belly or women standing holding their bellies, and really looking at how we've centered a pregnant person as the sole responsibility for preventing FASD. In 2022, we were able to undertake a redesign of our initiative, and we moved away from the With Child, Without Alcohol or individual responsibility mandate into what you see before you. Drink Sense moved towards a let's all support an alcohol-free pregnancy. Our public awareness campaigns included billboards and media ads, media buys that all focused on happy, healthy children, family units of varieties of makeup and models, but never an individual standing alone being felt the sort of the focus of sort of the focus of the only linchpin of being pushed towards responsibility. During our redesign process, we were able to engage with Melanie, who then connected us with a bunch of subject matters on the experts and practitioners in the field. From those collaborations, we came together with other opportunities to expand our organizational knowledge, including connections made with the iMaples group, which was exciting, and connections with projects that are undertaken by the wider FASD IC program and government team. Through the relationships, we were able to deepen our understanding of opportunities and challenges that exist within the provincial network supporting FASD education, prevention, and support. I will say here that liquor and lotteries mandate has shifted, and now it's LGCA, so our provincial regulator, the Liquor, Gaming, Cannabis Authority, sorry, I had to say it all in my head, is now responsible for doing public awareness campaigns around alcohol consumption. And as Melanie highlighted earlier, they're taking a really deep interest in the best practices, and we're really hopeful that they can learn from our mistakes and not go down the same path that we did as a provincial doing our public awareness campaigns. And I'm really excited to see the messaging that they're going to be having moving forward. All right, so back to the cheese. If we go to the next slide. So how are we folding it in beyond sort of public awareness campaigns and learning from Melanie? Again, I think the collaboration really deepens when we examine how we fold our cheese into our approach in managing our social responsibility fund. Our SR funding represents a significant portion of an overall department budget, and the department budget focuses on all three products that our Crown Corporation is responsible for: alcohol, gambling, and cannabis. But the Social Responsibility Fund is dedicated to supporting Manitoban health authorities or nonprofits in addressing harms from those three products. Our guiding policy, which is our funding framework, has embedded FASD throughout the priority areas that are qualified for funding. When we look at our priority areas, 3 out of the 4 specifically name FASD as areas that would qualify for funding. So the first priority area is treatment and support, and we specifically name support for persons with FASD or living with FASD as being qualified for applying for support for us. Community-based education and outreach is another priority area for us in designating funding, and prenatal support programs or supports for persons who may become pregnant while using substances is another area that we specifically name as qualifying and that we are interested in funding. And last but not least, significantly, we have a research pool. So we prioritize research into different areas around harm reduction. And recently, or over the last several years, we've been funding an epigenetics research program out of the University of Manitoba that is looking at some of those very specific, how do we look at testing? How do we look at the availability of being able to look at somebody's genetics and identify FASD? And how can that be used to support individuals in getting testing and supports later down the road? Knowing that we prioritize FASD within our funding areas, Melanie has often been able to support us in finding organizations who are new to us, or sometimes an organization that we know of that are new to them. Melanie has sometimes passed on connections to support the work that is undertaken in different areas of government, and we now have strong relationships with areas within the Department of Families, the Department of Homelessness and Addictions, and we're starting to make some collaborations within the Department of Justice. Through those collaborations, we've been able to support enhancements with Project Choices. So we fund some provincial-led programs like Project Choices because we understand that there can be some enhancements that communities can take to collaborate within their own space that still it can enhance or augment their provincial program. We also support Mothering Project and the FASD Family Network, as well as the Manitoba FASD Coalition. And then moving into the Department of Justice, we've been able to see or been informed about some projects that are looking at systems and system education. And so we've been able to partner with Gunning and Echeck on looking at how do we train systems outside of the city. So this could be police or educators, health practitioners on the colonial history of FASD and how that impacts communities when they're accessing services or supports from different provincial or municipal services. Though we're independent from government, the reality is we certainly want to support and see our role in aligning with the FASD strategy. The reality is because we are responsible to the same people, to the same residents and people throughout the province, there would be no benefit to Manitobans if we used our dollars and our expertise that not to further advance the FASD strategy. And so this allows us to coordinate to ensure that there isn't duplication of services, that I'm not sliding into somebody's inbox and saying, hey, do you need some more money when they're fully funded by the province? We can then say, well, there's this gap over here in this area because it's just not within the budget of a department of government, or it's not the priority for this year, but maybe we're looking at doing it next year. It allows us to have those conversations and then say, well, maybe we can move into this space, or this is an area where we can do some preliminary work in funding, and then maybe they can receive core funding from the province in a couple of years. So it's been really great to be able to have this collaborative conversation that allows us to make sure that we're working in lockstep rather than in opposition to each other.
Yeah, absolutely. As Maya said, I think that's been the key, really rewarding thing that's come out of our, of our joint work together is just to recognize that, yeah, when we align our priorities, we can do so much more and better work than we can when we're trying to go it alone. I can't tell you the number of times that a conversation or an email has resulted in me saying or typing the phrase, "Have you met Maya yet?" and then we introduce one another to the folks that we need to talk to, as Maya was saying. So yeah, making sure that we're sharing knowledge with each other and with each other's networks, inviting each other to talk to the people that we need to talk to. Hey, I think you're going into this area. You should talk to this person. Talking about, like Maya said, who we're funding, who they're funding, and holding each other up as valued partners. And that really is, as David Rose is saying, it needs to be celebrated. It's worth celebrating, and it's worth sharing so that hopefully others can, be inspired to find similar success through collaboration. So that's what we'll leave you with today. And we just want to thank you for the opportunity to speak today.
Well, thank you both so much. As a recipient of the Have You Met Maya email, I'm immensely grateful because I think you've really exemplified what this sort of collaboration can look like. And we're going to move over to Newfoundland. We're going to talk about the Alcohol Action Plan. Suzanne's going to lead that conversation. And we're going to hear a very different context and how that action plan was developed and what collaboration looks like there. So, Suzanne, I will pass it over to you.
Thanks so much. I'll just say from the outset that the Alcohol Action Plan is a provincial plan with a lot of moving parts. It's not fully dedicated to FASD. We work closely with FASD&L as part of the action plan itself. So if anyone does have questions about specific policy and programming, you can contact FASD&L directly or check out their website, because I wouldn't be able to speak to their resources and services as well as they could. But the Alcohol Action Plan, Reducing Harms and Costs in Newfoundland and Labrador, was launched in 2022. It's a 5-year public health strategy to reduce alcohol costs and harms. It has 13 action items and approximately 2.5 million budget annually for 5 years. So the next 2 slides will just give sort of a little bit of a background or reasoning as to why we established this action plan. If you could change the slide, sorry, thanks. So basically, there's a lot of stats on here and a lot of examples, but in Newfoundland and Labrador, we have some of the highest rates of costs and harms in Canada related to alcohol consumption. We have really high levels of access to alcohol, higher than the rest of Canada in terms of retail stores and other establishments. We have the highest rates of binge drinking in Newfoundland and Labrador. So that's where the alcohol action really comes from, a way to address these costs and harms. Sometimes this is referred to as a culture of alcohol within Newfoundland and Labrador. I tend to not use that argument as much, because I think it can slide down that slope. That culture of poverty sometimes does as well, where you start to blame a culture for what's happening. I think it's more accurate to talk about the social and structural determinants of substance use in Newfoundland and Labrador. But I will say, as other speakers have already mentioned, that the normalization of alcohol that exists across North America, I think, is perhaps a bit more amplified in Newfoundland and Labrador, and that's perhaps why we have higher rates nationally. Go to the next slide and then the one after. So the next slide is just really just giving an example of this. So basically, our alcohol revenues are 296 million, and then our alcohol costs and harms are 351. So it's a deficit of $55 million annually, and those are costs in terms of costs to our healthcare system, costs to our justice system, costs to social family structures, and so on. So the three focus areas of the Alcohol Action Plan are prevention, promotion, treatment, and availability. These are really broad categories that we use to sort of just organize our work. And some of the work we do crosses over in terms of these areas. So they're not really like a perfect categorization necessarily, but the 13 actions fall within these focus areas. And the overarching sort of governance of the Alcohol Action Plan and these focus areas is the steering committee. So the steering committee co-chairs are the Chief Medical Officer of Health for the province, Dr. Janice Fitzgerald, Nikki Legg, who's the provincial director of mental health and addictions for the province, and Jeff Bourne, who is the executive director of U-Turn and also a person with lived experience. And then within these focus areas, we have a network of working groups and subgroups, and on those working groups will be government partners, representatives from Newfoundland and Labrador Health Services, community organizations, and people with lived experience as well. So I'll just go through the three focus areas and sort of talk about the work that happens under each. So the first one is prevention and promotion. And the idea of prevention promotion is accessing credible information about alcohol can assist people to make more informed decisions. So we don't want to frame necessarily as sometimes prevention promotion campaigns can be viewed as, if they only knew type of information, but we do look at it as increasing people's access to information to make choices for themselves that work for themselves in their lives. And the actions that fall under this are increasing awareness about drinking patterns, continuing to support FASD and L in their work. We also work with the federal government on health and safety labeling, and we provide education to diverse target audiences to reduce stigma related to alcohol use disorder, and the impacts of adverse childhood experiences and intergenerational trauma. And I think the stigma under prevention and promotion is a really good example of an action that is not sort of specific to prevention and promotion necessarily. That sort of is broadly across the entire action plan and an issue for all areas within the plan. So the next focus area is treatment. And treatment includes taking a stepped care approach to alcohol supports, educating primary care service providers, police agencies, and community organizations to consistently screen and intervene in and offer supports and harm reduction measures, to incorporate screening, brief intervention, and referral tools at all points of care within our healthcare system, to explore the expansion of our opioid dependency treatment hubs, which provide rapid access to all substance use, and increase the number of providers as well. So we have recently expanded the opioid dependence treatment hubs to offer, for example, home-based alcohol withdrawal management, and support provincial harm reduction team in developing guidelines for harm reduction to be used across healthcare settings as well. And within treatment and really across the plan in itself is also monitoring, evaluation, and research. So that's ongoing since the beginning of the plan. And that's to develop indicators, monitor data such as alcohol sales, consumption rates, alcohol-related deaths, injuries, hospitalizations. So we have looked at specifically in terms of treatment, but that is also across the plan entirely. And then the last focus area is availability. So for availability, this area is led, interestingly, by the Department of Finance. So we're reviewing the current statutory minimum price per standard drink as defined in the Liquor Control Act for on-premise establishments, reviewing density and placement of on and off liquor establishments and the appropriateness of their current hours of operation, and amending the Liquor Control Act to develop regulations regarding alcohol-related marketing, advertising, sponsorships, and promotions to support moderate and responsible consumption of alcohol. This is led by the Department of Finance, but some of the work also is done by the evaluation and research team, especially around the development of recommendations for the Liquor Control Act around marketing, and also reviews of minimum unit pricing and things like that. But recently, the Department of Finance just completed the alcohol outlet density. Go to the next slide. Yeah, so basically, this is the contact information. I think Megan is here as well, listening. So you can contact Megan or I with any questions. We co-lead the Alcohol Action Plan, but I'm happy also to answer any questions today. It is a complicated plan. It's one of the only provincial plans in Canada related to alcohol action. I think there are some provinces now, including PEI, who are working on the development of similar plans. So it does have a lot of aspects. It has a lot of working groups, a lot of subgroups. So I didn't really know where to focus today. So if anyone has any questions about the governance structure or how the working groups are formed, or those things like that, those are open for questions as well.
I wanted to thank all of our speakers today. I feel like both presentations really did this wonderful thing where they gave us this gift where we spoke to the realities of alcohol use and alcohol use in pregnancy and how the normalization of alcohol has really impacted the uptake of alcohol use generally. And how impactful that is as an influence. I feel like it's not often talked about, and rather we focus on individual and individual decision making. So thank you for both presentations situating and reminding us of that. I hope that folks are able to join us for future webinars to get more information on CanFASD and to stay in the know with respect to all upcoming webinars. Please check out our website at www.canfast.ca or follow us on social media to find our resources. Finally, and most excitedly, as we wrap up this alcohol policy series today, we hope to see you at the 2025 Canada FASD conference happening this October in Toronto. Registration is now open and abstracts are being accepted until March 31st. And for folks who didn't know, there's an alcohol policy stream. So let's continue these conversations in Toronto this October. Thank you, everyone, and I hope you have a great day.